Welcome to the deep dive. Today, we're looking into something that's, well, it's at a really interesting crossroads of culture and science. We're talking about incense burning. And we've been digging into the research, a lot of it compiled by Professor Lin. And it seems the old idea that this is basically harmless it's being seriously challenged by the data now. Our mission today is really to unpack these global findings. What happens when objective science meets a really deep-seated tradition? It forces you to use your critical thinking.
And the sheer volume of research is what's so striking. This isn't a fringe topic anymore. If you look at PubMed, the medical database, there are over 200 papers on this.
200?
And 11 of them were published just this year, in 2025. That kind of speed tells you this is a serious, growing public health concern. It all breaks down to the ultrafine particulate matter.
PM2.5.
Exactly. PM2.5 and the heavy metals those tiny particles can carry.
Right, the core pollutant. And there was a really alarming real-world example of this in Taiwan recently. A news report covered an entire family, 3 generations, 8 people, who all needed medical treatment.
After 30 years of daily burning.
30 years. And they had lead poisoning.
Exactly. And the lead poisoning is, a very acute, obvious danger from heavy metals in the incense. But the particles themselves are a problem, a long-term neurological hazard, even if the incense is totally lead-free. There was a 2020 study in Hong Kong on older adults, and it found that long-term indoor exposure actually weakens cognitive functions.
Weakens how?
They found poor memory, weaker thinking ability, even issues with visual spatial skills. And the scary part is those deficits were still there when they checked again 3 years later.
So it's not temporary. It's pollution directly affecting how the brain works. But hang on, are we maybe conflating two different things here? I mean, the lead poisoning, that sounds like a bad batch, a manufacturing flaw. That's not necessarily an indictment of the practice itself, right?
That's a really important distinction to make, a very fair point. But the central issue, regardless of the material, is the particle size. That PM2.5, whether it's carrying lead or some other compound, those particles are small enough to get past your body's defenses. They go straight into the bloodstream.
And to the brain.
And to the brain. And the Hong Kong study also showed that this whole effect is amplified if you already have issues like diabetes or high cholesterol because your vascular system is already under stress.
Okay, so this is where we really get into the new 2025 research from all over the world. The UK, Singapore, India. If it's hitting the brain, what about the rest of the body?
The impact is systemic. It's sweeping. Let's start with the lungs, the respiratory system. Chinese research found that for people with diabetes, indoor incense exposure meant they had a 130% higher chance of impaired lung function.
130%. Wow.
Yeah. And then you have studies from Saudi Arabia and Bahrain linking family used directly to asthma attacks in kids and adults. Then there's the circulatory system. The Singapore Chinese Health Study, and this was huge, over 63,000 adults linked exposure for over 40 years to a higher risk of a disease where the arteries in your limbs get blocked.
That sounds incredibly serious.
It is. It's so serious that the UK's chief medical officer actually called out incense, specifically as a pollutant that contributes to heart attacks, stroke, the whole spectrum of cardiovascular disease.
And I was really struck by the research on children.
Yes.
A Vietnamese study had this shocking data point. For school children in that area, household incense was the #1 source of PM2.5 exposure.
The primary source, not traffic, not industry, what's happening in their own homes.
And then Taiwan found a link between how often you burn it at home and an increase in acute bacterial sinusitis in kids.
Right. And research from India just adds to the pile, identifying it as a major non-smoking risk factor for COPD, chronic obstructive pulmonary disease, and for severe allergic eye diseases.
So if we just synthesize the data from these 11 new papers, we're talking about lung damage, asthma, COPD, cognitive decline, stroke, blocked arteries, sinusitis, allergic eye disease. It's an incredible catalog of harm.
And this brings us back to that core question for you, the listener. When you have this much objective, global scientific evidence from over 200 sources that defines a systemic public health hazard, critical thinking demands that you take it seriously. You have to be able to look past the comfort of a tradition when the health risks are this clear.
That Vietnamese finding is the one that really sticks with me. That incense in the home is the primary source of lung-damaging pollution for children. It just makes you wonder what other unseen hazards might be hiding in our other everyday practices, things we just accept as safe because we haven't turned the full force of science on them yet. Something to think about until our next deep dive.